Thank you for the briefing. I'm Johannes and I come from Norway, and I have once written Norway's Women's Health Report a long time ago. You mentioned that education of women is very important, predictive for how it goes. I have just reviewed for the Norwegian Medical Association's journal a book, not from gynecology and obstetrics, but from teaching, on the impact of schooling of girls, number of years in school, on their ability to be good mothers, and probably also to provide for their children's health. This is a report on improving women's health, and I wonder how much the status of women and the gender issue comes into account here, because women are giving birth, they're women. The ones that help them during delivery are midwives, they're women. Did you look at the status of women in most of those? I haven't read the report, but can you elaborate a little bit on that?
What we did is to look at, to use a two-pronged approach. One is individual country case studies, what is happening in those countries. And the other was to look at the global survey where we have documented up to 300,000 deliveries in 24 countries, and to look at the antecedents related to the maternal deaths that took place during that time. And then to look at all the factors that are contributing, which are being collected, which is what has been collected, the education, the parity, a number of things. And so we were able to document and say, look, amongst those that died, these were the immediate causes. And then when we made the adjustments for the immediate causes and went backwards, two key outstanding issues were that. But I fully agree. I mean, if you're talking of education, the benefits of education is also the ability and empowerment that comes with it, the potential for being able to make a decision. So instead of waiting for somebody to say that she needs to go to hospital, the woman is empowered to make the decision that I'm not well, I need to go to hospital. So some of the social factors that may inhibit access, that may inhibit immediate utilization or seeking care, it does affect health care seeking behavior. That's where the difference then comes in. At times, some of the issues that have come have been the role of men, you're quite right, the role of religions and so on. But even within that context, I think when you have educated the girl child, when you've empowered her to be in charge, at times it means she's able to overcome some of the issues which do have implications downstream.
Bueno, I might just add, actually, there's an article in this issue by Professor Tony Costello and his group. Tony Costello has written a number of articles from University College London. He works at a charity called Mother and Children First. And his interventions in Nepal, some states in India and Africa, has been community mobilization. So he goes to small villages and get all the women to sit around, and he draws some diagrams of women bleeding, or some abortion, or transport. There are some pebble stones. Then the women vote, which is the one which is which they want to improve first, and they collect some money and so on. So that is one of the other approaches we have recommended in this report. That means when they collectively, about 30, 40 women get together and then they voice their opinion, then the men can be motivated to do things better in some way. They have a better voice. And interestingly, if you see some of the photographs, the boy and girl child of that mother also goes for these meetings. So they also, from a very young age, they get an idea of what are the things, are the problems, and so on. So I think your point is very important about education and empowering women. And if they're educated, they will be empowered. But in the meantime, empowerment, we are trying to use that model of the community to see whether they can be empowered.
I thought you had something to add on.
No, it's all right.
just to add to that, one issue we have noticed as well is the combination of facility and community interventions, where some of these innovations within the community are complemented by interventions at facility level, so that when you are able to mobilize, when you're able to sensitize communities and you improve their healthcare seeking behavior and they go to a healthcare, that healthcare is also equipped and able to, both in terms of human resources, in terms of drugs, in terms of blood, and in terms of equipment. So that complementarity between incentives that work within the community and ensuring that the facility is able. It can be a disincentive if people simply go to a health facility and all they see is that those that have gone do not come back. They may have gone because they were in need of cesarean section. It could not be done, and the next thing is they die. So it becomes a disincentive to use the facility. But where you are able to strengthen the facilities and you are also mobilizing the communities, that interface tends to augur well for having safe deliveries and pregnancies and improving reproductive health.
Dr. Allen?
Yeah, I think it's well known that we can't separate education and health. You cannot have health without education, and can't have education if they're not healthy. So really, and some of the work that we have done at FIGO is we want to make sure that at least there's a delay in that first pregnancy. There is care for young women that come into the hospital to have that first baby. So therefore, if they are healthy, we believe their children are going to be healthy, and these mothers will send their children to a school for education. So it's kind of our part into making sure that the next generation of these young women receive the education they need to make choices and decisions. And most of the projects, when you read about the Safe Motherhood projects in the 10 countries, had a large community component.
Thank you. Any other question? Anything? Well, so we came to an end. Thank you to our distinguished speakers. Thank you to you all. Just let me quote Professor Moran, because we have focused on MDG 5, but he says that every MDG has an impact on women's health as they affect women most. We think about eradication of poverty, gender equality, education, reduction of child mortality, HIV, AIDS, tuberculosis, and malaria, all the diseases impact on women. Thank you very much. Good evening.